Scarlet fever is a disease resulting from an infection that produces a toxin responsible for a distinctive red rash. It has been known since ancient times, but it was not until the 19th century that the link between scarlet fever and streptococcal infection was understood. The disease was first described in the medical literature in the 17th century by Sydenham in 1676, as a distinct entity from measles and other similar diseases with rashes. However, the bacterium that causes scarlet fever, group A Streptococcus, was not identified until the late 19th century by Theodor Billroth, Friedrich Felleisen, and others. The toxin responsible for the rash was identified in the 20th century. With the advent of antibiotics, particularly penicillin, the incidence and severity of scarlet fever have significantly decreased. Scarlet fever is an infectious disease caused by toxin-producing strains of the bacteria Streptococcus pyogenes, also known as group A Streptococcus, gas. The route of infection typically involves the following steps. The bacteria are usually spread through respiratory droplets expelled when an infected person coughs or sneezes. The bacteria can also be on objects or surfaces if droplets have landed on them, and touching these can lead to the transfer of bacteria to the mouth or nose. The bacteria enter the body through the mouth, nose, or, less commonly, a break in the skin. Once inside the body, the bacteria can colonize the throat or skin, particularly if there is a sore throat or skin wound. The bacteria multiply and may produce a toxin that can lead to the characteristic rash of scarlet fever. After the bacteria have been acquired, there is typically an incubation period of 2 to 4 days before symptoms start to appear. The initial symptoms often include a sore throat, fever, headache, and swollen lymph nodes. Within a day or two, the distinctive red rash appears, usually first on the neck and chest, then spreading to the rest of the body. Individuals with scarlet fever are infectious to others starting from before the onset of symptoms and continuing until after they have been on antibiotics for at least 24 hours, or for up to 2 to 3 weeks if not treated. Scarlet fever is characterized by a number of symptoms that usually develop in association with a streptococcal throat infection. The following are typical symptoms. Sore throat. This is often severe and may be accompanied by difficulty swallowing. Fever. A high temperature of 38.3 degrees Celsius, 101 degrees Fahrenheit, or above is common. Red rash. The rash typically starts as small red spots on the neck, underarm, and groin areas before spreading to the rest of the body. It has a sandpaper-like texture and may be itchy. Strawberry tongue. Early in the disease, the tongue may have a white coating, which peels away after a few days, leaving the tongue red, swollen, and bumpy, resembling a strawberry. Flushed face. The face may appear red with a pale area around the mouth. Postias lines. Red streaks may appear in the folds of the body, such as the armpits, elbows, and knees. Swollen neck glands. The lymph nodes in the neck may swell and become tender to the touch. Chills and body aches. These are less common but can occur as part of the body's response to the infection. Nausea or vomiting. This may occur, especially in younger children. Peeling skin. As the rash fades, usually around 1 to 3 weeks after symptoms start, there may be peeling of the skin on the fingertips, toes, and groin area. Scarlet fever is treated with antibiotics, which are used to eliminate the group A Streptococcus bacteria that cause the infection. Here is the typical approach to treatment. Antibiotics. The first-line treatment for scarlet fever is a course of antibiotics, usually penicillin or amoxicillin, taken orally for about 10 days. For individuals allergic to penicillin, alternative antibiotics like erythromycin or clindamycin may be used. Fever and pain management. Over-the-counter medications such as acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, can help reduce fever and relieve throat pain. Hydration. It's important to drink plenty of fluids to stay hydrated, especially if fever is present. Rest. Adequate rest helps the body fight off the infection. Throat lozenges and gargles. For older children and adults, throat lozenges and warm saltwater gargles can help soothe a sore throat. Isolation. To prevent the spread of the infection, the infected person should stay home from school or work for at least 24 hours after starting antibiotics and until no longer feeling ill. Follow-up. A follow-up visit with a healthcare provider may be necessary to ensure that the infection has been completely eliminated. Prevention of spread. Regular hand washing, not sharing utensils, and covering the mouth and nose when sneezing or coughing can help prevent the spread of the bacteria. Skincare. For skincare, especially when there is peeling or itchiness, moisturizers and lotions can be helpful. It's important not to scratch the rash. Monitoring for complications. Although rare, complications such as rheumatic fever or kidney inflammation, post-streptococcal glomerulonephritis, can occur. Early treatment reduces the risk of these complications. Always follow the healthcare provider's instructions when taking antibiotics and complete the full course, even if symptoms improve before the medication is finished. This ensures that the infection is fully treated and helps prevent resistance to antibiotics. If symptoms worsen or if new symptoms appear, it's important to seek medical advice promptly.